If you are over 70 and your doctor has told you your blood pressure is too high, there's something you are probably not being told. Not because your doctor is wrong, but because the real cause of high blood pressure in older adults is almost never the one getting attention. And if you're treating the wrong cause, you may be managing a number without solving the problem. Stay with me, because what comes next could change how you approach this for the rest of your life. This is not about fear. It is not about stopping your medications or second-guessing your physician. This is about understanding what is actually happening inside your body as you age, so you can work with your doctor more effectively and take back more control over your own health. That is what this channel is for. Calm, clear, evidence-based information for people who are serious about staying well. Now let us start with what is actually happening. After the age of 60, your cardiovascular system goes through changes that most people are never told about. Your arteries, which were once flexible and elastic, begin to stiffen. This is not a disease, it is biology, but it has enormous consequences for your blood pressure. Think of a young, healthy artery like a rubber hose. When your heart pumps blood through it, the artery stretches slightly, absorbs some of the force, and then gently pushes the blood along. That flexibility is protective. It keeps pressure stable. Now think of an older artery that has lost some of that flexibility. It is more like a rigid pipe. When your heart pumps, there's nowhere for that pressure to go. It rebounds, it spikes, and your heart has to work harder with every single beat. Large cardiovascular aging studies consistently demonstrate that arterial stiffness is one of the primary drivers of isolated systolic hypertension, which is the kind of high blood pressure most common in people over 65. That's when your top number, the systolic number, is high, but your bottom number is normal or even low. This pattern is not the same as the high blood pressure younger adults experience, and it does not always respond the same way. Here is why that matters. Many of the lifestyle recommendations for blood pressure were developed in studies of younger adults. They are not wrong, but they are incomplete if you are 70 or older. Your body is responding to different forces, and there are specific habits, some of them things you do every single day, that are making arterial stiffness worse without you realizing it. Let's go through them. The first is chronic dehydration. Most people over 70 are mildly dehydrated almost every day. Not severely, not in a way you would recognize, but enough to affect your blood pressure in a real and measurable way. Here's the mechanism. When your blood volume drops, even slightly, your body activates a stress response. Your kidneys release a hormone called aldosterone. Your blood vessels constrict. Your heart pumps harder to maintain circulation. Your blood pressure rises. Now here is what makes this especially dangerous after 70. The thirst signal weakens with age. Research in aging physiology consistently shows that older adults do not feel thirsty at the same threshold younger people do. By the time you feel thirsty at 75, you may already be meaningfully dehydrated. Think about a typical morning. You wake up. You've been lying still for 7 or 8 hours. You haven't had water. Your body is already starting from a deficit. Then you have coffee, which has a mild diuretic effect. Then you go about your morning without drinking much water because you simply do not feel thirsty. And by mid-morning, your blood pressure has climbed. Cardiology research shows that even mild dehydration can raise systolic blood pressure by 10 to 15 points in older adults. That's not a small number. That's the difference between a controlled reading and a concerning one. The fix is not complicated. 8 cups of water across the day. Not all at once, small amounts, consistently. Warm water if cold bothers you. Herbal tea counts. What matters is regularity. Make it a schedule, not a feeling, because you cannot trust the feeling after 70. And here's what most people miss. Many older adults assume that waking up 2 or 3 times per night is simply what aging feels like. Sometimes it is. But it's worth having a conversation with your doctor about sleep quality, because improving it may reduce your blood pressure more than some people expect. The fifth factor is something almost no one connects to blood pressure, and that is low vitamin D combined with low magnesium. Vitamin D doesn't just protect your bones, It plays a direct role in blood vessel function. Research published in major hypertension journals shows that people with low vitamin D levels have significantly higher rates of hypertension. The mechanism involves the renin-angiotensin system, which is the hormonal pathway your kidneys use to regulate blood pressure. When vitamin D is low, this system becomes overactive. Your blood vessels stay more constricted than they should be. Your pressure stays elevated. Magnesium works alongside vitamin D. It acts as a natural relaxant for smooth muscle tissue, including the muscle inside your artery walls. When magnesium is sufficient, your arteries can dilate more easily. When it's low, they stay tighter, and most adults over 65 are not getting enough magnesium from their diet. Studies in geriatric nutrition consistently demonstrate that magnesium deficiency is widespread in older populations, partly because the kidneys become less efficient at retaining magnesium with age, and partly because many common medications, including certain diuretics used to treat blood pressure, deplete magnesium further. Ask your doctor to test your vitamin D level at your next visit. The test is simple and covered by most insurance. A level below 30 nanograms per milliliter is worth addressing. Many physicians now consider levels between 40 and 60 to be more protective for older adults. For magnesium, food sources include dark leafy greens, pumpkin seeds, almonds, and black beans. A supplement can also help, but speak with your physician first, especially if you have kidney disease, because magnesium is cleared by the kidneys. And here's what most people miss. These two deficiencies often exist together. They are easy to correct, and they are almost never the first thing a doctor investigates when blood pressure is elevated. You may need to ask directly. The fourth factor is something sitting in your kitchen right now, and it's not the salt shaker. Most people know that sodium raises blood pressure. What they don't realize is that in older adults, the hidden sodium is the dangerous sodium. Not what you add to food, what is already inside it. Processed foods, canned soups, deli meats, frozen meals, bread, and even breakfast cereals contain extraordinary amounts of sodium. A single can of soup can contain over 800 milligrams of sodium. That one can is more than half the daily limit. After 70, your kidneys become less efficient at clearing excess sodium from your bloodstream. This is a normal part of aging, not a failure, but it means that the same amount of sodium that your body handled well at 50 now stays in your system longer, draws in more water, increases blood volume, and raises pressure more significantly. Large population studies in cardiovascular health consistently show that sodium sensitivity increases with age, meaning the blood pressure response to sodium becomes stronger, not weaker, as you get older. The solution is not complicated. Read labels, look at the sodium content per serving before you buy. Choose low-sodium versions of canned goods when they're available. Cook more of your own food when you are able. And when you eat out, ask for sauces on the side, because restaurant food is the highest sodium category of all. Here's what most people miss. The strongest source of hidden sodium for many older adults is bread. Not just white bread, whole grain bread. Even healthy-seeming bread can contain 200 milligrams of sodium per slice. 2 slices at breakfast, 2 at lunch, and you have already consumed over a third of your daily target before you've added any other food. Now we're at the midpoint of what I want to share with you today. And I want to pause here because what comes next is the factor that is almost never talked about. It doesn't come in a bottle, it doesn't show up on a food label, and for people over 70, it may be the most powerful driver of sustained high blood pressure of all. Keep watching. The fourth factor is poor sleep quality, and this one has a direct biological pathway to your cardiovascular system that most people are completely unaware of. During deep sleep, your blood pressure naturally drops. Physicians call this nocturnal dipping. It's not just rest, it's active repair. Your heart rate slows, your arteries relax, inflammatory markers in your blood decrease. Your body uses this window to recover from the cardiovascular stress of the day. When sleep is fragmented, when you wake frequently, when you spend too little time in deep sleep, that nocturnal dip doesn't happen adequately. Your blood pressure stays elevated through the night, and because nighttime blood pressure is one of the strongest predictors of cardiovascular risk in older adults, this matters enormously. Research in sleep medicine and cardiology consistently shows that non-dipping blood pressure patterns, where pressure stays high through the night, are associated with significantly higher risk of stroke, heart attack, and kidney damage compared to patients whose pressure drops appropriately during sleep. After 70, sleep architecture changes. Deep sleep becomes shorter, lighter sleep stages dominate. Bladder urgency interrupts sleep more often. Pain, joint discomfort, and medication effects can all fragment sleep further. There are things you can do. Keeping your bedroom cool and dark supports deeper sleep. Avoiding screens for at least an hour before bed reduces stimulation to the brain. Limiting fluids after 6 in the evening reduces nighttime bathroom trips without causing the daytime dehydration we discussed earlier. And if you suspect you have sleep apnea, where you stop breathing briefly during sleep, please speak with your physician.